Question number 1. An elderly male came with an epigastric and right upper quadrant pain of several weeks with visible jaundice. No history of dyspnea. On physical examination, ascites is present. Acidic fluid analysis shows an SAAG level of 15. Acidic protein level 10, which normally is 0.3 to 4 gram per deciliter. What is the diagnosis? A. Portal hypertension. B. Cirrhosis. C. Pancreatitis. D. Congestive heart failure. The most likely diagnosis in this case is option B. Cirrhosis. Reasoning. The absence of dyspnea and the presence of ascites suggest that the fluid accumulation is more likely due to portal hypertension and cirrhosis rather than congestive heart failure. While other conditions such as portal hypertension and congestive heart failure might also be considered. The presence of jaundice, ascites, and the specific acidic fluid analysis findings strongly point toward cirrhosis as the primary diagnosis in this elderly male patient.
Question number 2. 30-year-old male has had worsening tremors of his hands. This has been present for 2 years, but increasingly impaired his activity of daily living. He also has sweating, heat intolerance, and episodes of palpitations. On examination, he has sweaty palms and there is mild bilateral hands postural tremor. No resting tremor of the hands. What is diagnosis? A. Wilson disease. B. Hyperthyroidism. C. Parkinson disease. D. Vitamin B12 deficiency. The most likely diagnosis in this case is option B. Hyperthyroidism. Reasoning. The patient's chief complaint of worsening tremors in the hands is a significant symptom. The fact that the tremors have been present for 2 years and are increasingly impairing the patient's activities of daily living, suggesting a chronic and progressive condition. Sweating, heat intolerance, and palpitations. These symptoms are classic signs of hyperthyroidism.
Question number 3. A 40-year-old man came with slurred speech and weakness in his right upper limb. The following day, all his neurological signs resolved. Physical examination is normal and he has no carotid bruit, but carotid Doppler studies show 80% stenosis at the bifurcation of the left carotid artery. What is the appropriate surgical approach for this patient? A. Observation for spontaneous recovery. B. Thrombolysis. C. Endarterectomy. D. Angioplasty. The correct answer is endarterectomy. Carotid endarterectomy is a surgical procedure used to remove the atherosclerotic plaque causing stenosis in the carotid artery. This procedure is indicated for patients with symptomatic carotid artery stenosis of 50%. Or more, especially if they have had a recent transient ischemic attack or minor ischemic stroke. The goal is to prevent further embolization and reduce the risk of a more serious stroke. Observation for spontaneous recovery is not ideal in cases of significant carotid stenosis with symptoms, as the risk of future stroke is high. Thrombolysis and angioplasty are less likely to be appropriate in this case, as the patient's symptoms have already resolved, and the primary issue is the stenosis caused by atherosclerotic plaque. Question number 4. The Ministry of Health is organizing campaigns, lectures, and health education to teach the public about the dangers of obesity and its associated complications. What kind of prevention is this? A. Tertiary. B. Secondary. C. Primary. D. Primordial. The correct answer is option C, primary prevention. Because primary prevention aims to prevent the onset of a disease or condition by addressing risk factors and promoting healthy behaviors. In this scenario, the Ministry of Health is focusing on educating the public about obesity and its complications before these issues arise. By raising awareness and promoting healthy habits, They are working to prevent obesity and related health problems from developing in the first place. Question number 5. A 30-year-old pregnant woman presented with a headache and cough. A pharyngeal examination reveals erythema without purulent exudate. If the patient has pneumonia due to chlamydia pneumonia, which of the following drugs is safe for her? A. Azithromycin. B. Tetracycline. C. Erythromycin. D. Ofloxacin. The correct answer is option A, azithromycin. It is considered safe for use during pregnancy and is often prescribed for treating respiratory infections including pneumonia caused by chlamydia pneumonia. It belongs to the macrolide class of antibiotics and is commonly used when other antibiotics, like tetracycline and doxycycline, are contraindicated during pregnancy due to their potential effects on fetal development. Erythromycin is another macrolide antibiotic that is considered safe during pregnancy and could be an alternative choice for treating chlamydia pneumonia if azithromycin is not available or not tolerated. Question number 6. A woman with stillbirth presented with signs of disseminated intravascular coagulation. Cervical os dilation is 6 centimeters. How will you manage? A. Augment labor. B. Cesarean section. C. Expectant management. D. Dilation and curettage. Given these factors, performing a cesarean section is often the most appropriate course of action. It can help ensure safe and timely delivery of the fetus and address potential complications associated with both the stillbirth and the mother's disseminated intravascular coagulation condition, allowing controlled environment for the delivery and immediate attention to the mother's medical needs. Options such as augmenting labor, expectant management, and dilation and curettage may not be appropriate in this scenario, as they do not directly address the situation of stillbirth and the associated health risks to the mother, especially considering the presence of disseminated intravascular coagulation. Question number 7. A 75-year-old woman with metastatic breast cancer presented with possible spinal cord compression. Which of the following clinical presentations would suggest cord compression? A. Bilateral knee pain. B. Skin rash over the legs. C. Loss of urinary sphincter control. D. Abnormal movement of the hands. The correct answer is option C. Loss of urinary sphincter control. This is a classic sign of spinal cord compression. It indicates that the compression is affecting the lower spinal cord or cauda equina region, leading to disruption of the nerves controlling the urinary sphincter, resulting in incontinence. Question number 8. A 34-week pregnant woman presented with blurred vision, headache, and blood pressure of 180/100. What is the most appropriate next step that should be taken? A. Stabilize and wait till 37 weeks. B. Call anesthesia now and deliver. C. Stabilize and give magnesium sulfate and deliver. D. Stabilize and give steroid and nifedipine or labetalol. The correct answer is option C. Stabilize and give magnesium sulfate and deliver. The clinical presentation described is suggestive of severe preeclampsia or eclampsia, both of which are serious pregnancy-related conditions that can be life-threatening for both the mother and the baby. In such cases, immediate intervention is required to protect the health and well-being of both.